Hello, members of the VCU team. You know, in the last few months, we have all met innumerable challenges related to the COVID-19 pandemic with tremendous ingenuity, resilience, and determination. And while these challenges continue, we've learned so much since this all began on our journey together just a few months ago. Every day we discover more about this novel coronavirus, how it's spread, and how we respond to it. We have firsthand experience in COVID-19 clinical care and in our research. We also know more about how important being on campus is to our clinical, academic, and research missions. We can learn, work, and live in an era of COVID when we all come together responsibly. I know VCU and its great strength as a community, one that truly values and cares about each and every person. I trust everyone to promote and exhibit safe behaviors. Based on our values and the science that we know, VCU has determined that we will begin a phased on-campus reopening of the university in June, starting primarily with our health sciences programs as well as research faculty and staff. We will start the fall semester altogether on August 17th. Our return to campus will be a different experience than before the COVID-19 crisis. Many details have been worked out, and there are many still yet to come. Here are some of the most important aspects of our return. Of course, our highest priority is the safety of our students, faculty, staff, and the surrounding community. Generally, our guiding principles will include following applicable CDC, state, and VCU health guidance, evaluating and implementing safety measures that support our phased return, encouraging flexibility in addressing the needs of vulnerable members of the VCU and Richmond communities, monitoring the health of our community and responding promptly to any increase in infection rates, consistent with the advice of medical and science professionals. Flexibility in addressing new situations, including anticipated waves of COVID-19 and changes in requirements, guidelines, and best practices. Each of us has roles and responsibilities to promote safety in our learning, work, and living environments. The university will provide resources such as face coverings or masks, supplies, procedures, education, screening, and tracing and testing protocols to support the phased plan for our return. We'll provide supply kits for returning students and employees that includes washable masks, hand sanitizer, and disinfectant spray. We'll clean facilities much more frequently with a focus on high-touch surfaces, and we'll provide hands-free temperature screening stations and an app and/or website for daily health monitoring and prevalence testing throughout the year. All students and employees will be required to complete return-to-campus training and acknowledge requirements, with additional training specific to managers also mandatory. Students and employees will monitor their health daily, and testing will occur according to our protocols. All students and employees will wear face coverings or masks. Physical distance guidelines will be applied to all settings, such as classrooms, meeting spaces, dining facilities, elevators, and all of our spaces. Students and employees will clean and disinfect their personal and shared spaces before and after they use them. And students and employees will report symptoms associated with COVID to a call center hotline. So, what does all of this mean for our return, and what will VCU look like? First, this is a phased return. Faculty and students who are involved in clinical placements and services, field placements, lab and lab simulations, and similar activities will return in phases. The first is in June, followed by 2-week increments in July. Research faculty, staff, and trainees will begin their initial return in June, with the research workforce gradually scaling up over the next few months. Non-designated staff who cannot work remotely will also return in those same increments. By August 17, all positions needed to support the in-person student experience will return to campus. Others will continue to telework. On-campus classes may be smaller because of physical distancing requirements, and some may require students to alternate in-person attendance, and many courses will be a blended format of in-person and online. Faculty members and students will have many more resources to support online learning. And the calendar will be different. Our own epidemiologists and others across the country tell us that our campuses will be much safer the less that we leave and return to campus, which risks bringing back infection to us. We should also avoid the height of the flu season. With this in mind, the semester will run without a fall break or reading days beginning Monday, August 17th through the last day of classes on Tuesday, November 24th. After the Thanksgiving holiday, final exams will be conducted remotely, November 30th through December 4th on the MCV campus and November 30th through December 7th on the Monroe Park campus. However, some students in the health sciences and elsewhere may be physically returning after Thanksgiving so that they can resume their clinical placements and similar activities to which they are committed. Of course, this affects commencement, which is scheduled for December 12th. We'll evaluate guidance on larger gatherings over the next several months, and we'll explore how we'll recognize the classes of 2020. So, this is how we intend to proceed based on where we are today. As guidance, best practices, and circumstances change, that may require changes in operations, modes of instruction, and services at the university. We'll keep you updated on all of these changes. There's much more information about our return to campus on the new Together VCU website, which is available at together.vcu.edu, and it includes specific plans related to how we'll move forward. These resources will answer many of your questions. We're still working on details to answer other questions that we know you'll have. And the fact is, we'll need to continue to be flexible as situations change. A brief word about the university's budget, which the Board of Visitors will consider at its June 5th meeting. There are so many questions and much concern, especially about furloughs. The administration will not recommend furloughs at this time because we don't know whether they'll be needed. The use of furloughs is dependent on declines in state and federal funding as well as enrollment. The 2021 budget adopted by the board will be revised pending any changes to tuition, fees, and state and federal support revenues. If furloughs would be needed, they would include all faculty members and staff with salaries higher than $50,000. We've proven that we're a community that can quickly and successfully adapt and pivot to respond to the unforeseen. We've also had the great benefit of many minds coming together singularly on this challenge, and we've been able to strategically leverage the expertise and resources of our academic health system, all coming together as one VCU. Now, we'll demonstrate how we'll be responsible together in our commitment to foster the health and welfare of everyone in our community. We can pursue our academic, research, and clinical care missions and care for each other as one VCU. Thank you, all of you, for joining in this critical commitment. I look forward to seeing all of you soon.